I was exposed to medicine from a very young age as my father was a physician and ophthalmologist. I started to volunteer at the VA hospital, the Veterans Hospital where my dad worked. And so helping take care of veterans was very gratifying as well, helping serve those that served our country. I'm Sean Lee, a plastic and reconstructive surgeon here at Penn Medicine. My focus in plastic surgery is breast reconstruction, microsurgical breast reconstruction, aesthetic surgery, as well as general plastic reconstruction from head to toe. In my field, my subspecialty is microsurgery, and so that involves moving tissues around the body and basically transplanting them where reconstruction is needed and connecting very microscopic blood vessels together so that the tissues may survive and function the way they're supposed to. A large portion of my practice is breast reconstruction, and these are patients that come to me after breast cancer and typically after mastectomy or partial mastectomy, and we help restore the patient's self-image after cancer treatments. It's a very emotional time for patients, and they're going through a lot, and my job is really to kind of explain to them their options and what are the risks and benefits and what are the best options that for their specific situation, their body type and habitus, what is available for them for reconstruction, and just really listening to them and making sure that my goals for them and their goals for themselves are aligned so that I can help best treat them. The best part of my job is helping take care of patients and seeing them restored and seeing them move on with their life after reconstruction. I think that's the most gratifying part of my job.